We will now be switching over and taking a look at what it is like for the student to transition from the classroom to the fieldwork environment. Based on our survey results, several fieldwork educators experience issues with poor student preparation during fieldwork. This could be due to the fact that students are lacking confidence going into fieldwork, or they might feel as if the educational curriculum did not prepare them for what it is like to be in this type of environment. This is not the way students should feel going into fieldwork. They have put in hours of preparation inside and outside of the classroom and are developing the skills and knowledge they need to succeed in the clinic. Currently, the University of Toledo facilitates student preparation for fieldwork through a course that addresses issues of clinical supervision, Level 2 fieldwork policy, procedures, and documentation, as well as professional development. During this course, students are asked to develop an individualized plan of preparation of fieldwork that requires them to reflect on their personal levels of proficiency in various aspects of client care and develop a plan to prepare them specifically for their upcoming fieldwork placement. Assignments such as this one could help ease the student's transition from the classroom to the clinic. We think it is important for therapists to look for something like this from students prior to the arrival at the site. This is one way that could help ease the student's transition from the classroom to the clinic. Although not all curriculums require this type of assignment, there are resources available that can help students purposely prepare for what is to come in fieldwork. Perhaps you might suggest that students purchase the book Occupational Therapy Fieldwork Survival Guide, a Student Planner by Bonnie Napier. Within the book, there is a chart that students can fill out and submit to their fieldwork site prior to the first day. This chart helps a student organize a way to bridge course material over to fieldwork. There is also a checklist within the book where the students can access and organize other content areas that they found useful or necessary for their personal preparation for fieldwork during their review of material. Resources like these can help students feel more prepared and ready to take their first step inside of the clinic. Another essential part of fieldwork is to encourage open communication with the student. Open communication can help the student feel more comfortable and may help to decrease the amount of stress or anxiety they are experiencing prior to entering into fieldwork. Keeping that line of communication open and sharing ideas with students regarding how to prepare for their first day might be a critical part to their success. Most often, describing expectations explaining that you have for them prior to the arrival will not only help the student, but the fieldwork educator as well. Another way to help the student prepare for fieldwork is to suggest that they take a look at the American Occupational Therapy Association Fieldwork Data Form. This resource can be found on the American Occupational Therapy Association website, and it is also attached to this module. The form will be discussed in greater detail on the following slide. The IOTA data form is used to summarize information regarding the program at a fieldwork site. Students can more thoroughly prepare for their upcoming fieldwork placement if they can review information obtained in the fieldwork data form. Within the form, students will find valuable information regarding the characteristics of the fieldwork setting, the client population, commonly used assessments, interventions, and expectations and opportunities for students at the site. The secondary purpose of the form, and the reason why we are really looking into it today, is because it can be used to document the connection between the curriculum design of a given OT or OTA educational program with its fieldwork component. Students can benefit significantly from this section if it is completed with good detail. This form can be completed by the combined efforts of the fieldwork educator, the OT or OTA student, and/or the academic fieldwork coordinator from the program. Again, this form can be accessed through the American Occupational Therapy Association website and is also attached to this module. Let's now consider a case study about a student who is having a difficult time transitioning from the classroom to the fieldwork environment. We would like you to take some time to reflect and think of strategies you could use to deal with this challenging situation. Ursula is a Level 2 fieldwork student in an outpatient clinic. Her fieldwork educator, Casey, is an OT who has noticed that Ursula has been struggling with transitioning what she has learned in the classroom into the clinic. She is very enthusiastic and is great when it comes to engaging with clients, but she struggles to develop and implement treatment plans with her clients. Casey finds herself having to step in during every treatment session to make sure each treatment is appropriate for the clients. As of right now, Casey is not comfortable letting Ursula be on her own. When Casey asks her why she chose to do a certain occupation with a client, she often has a difficult time expressing her clinical reasoning, even when what she is doing is on the right track. When Ursula struggles to come up with an answer, Casey notices a decrease in her confidence. Casey is unsure of how to deal with this situation. Please pause the presentation and take the next 5 minutes or so to reflect and think about what you would do in this type of situation. Please jot down what you think the issue is with the student, as well as how you might go about addressing this issue. Okay, so it is clear that Ursula is lacking preparation, has a difficult time expressing her clinical reasoning, and has a decrease in confidence. As a fieldwork educator, what do you think you could do to help Ursula in the clinic? Perhaps suggesting that she look into resources previously mentioned on the slides would be a great place for her to start. The Occupational Therapy Fieldwork Survival Guide, a student planner by Bonnie Napier, could help her organize what she has learned in class and bridge that material she has learned over to fieldwork. Being able to learn how to bridge or merge the material together will help her understand more about what is going on in the clinic. Ursula may also have benefited from reviewing the IOTA data form with her fieldwork educator. Since Ursula is also having a difficult time with clinical reasoning, it might be beneficial to think out loud in front of her when developing or modifying interventions. We will be covering this topic in greater detail later on in this presentation.